Post-traumatic stress disorder, or PTSD, is a psychiatric disorder that occurs in individuals who have experienced a traumatic event, with nearly 6% of the world's population diagnosed and greater affected. Symptoms in individuals with PTSD come in many different shapes and sizes, namely due to a difference in amygdala response type. Common symptoms include problems with emotional regulation, heightened fear response, insomnia, and cognitive impairment. The amygdala is a small, almond-shaped brain region with a big job. Responsible for assessment of threat-related stimuli, it initiates the fight-or-flight response. However, PTSD is not the result of one kind of amygdala malfunction, but two. These differences in amygdala response phenotype can be categorized as hyperarousal versus hypoarousal. Hyperarousal is an overreaction of the amygdala to stimuli in which an individual is triggered by less severe stimuli than their healthy peers, making them fearful and aggressive. Conversely, a hypoaroused amygdala is an underreaction of the amygdala to stimuli, in which an individual is not triggered by stimuli their healthy peers would be, resulting in depression and brain fog. Currently, individuals are phenotyped using an MRI machine, the imaging of which professionals evaluate to then determine the best course of action, resulting in room for biases and error. For the money and time an MRI demands, there has to be a better way.
Presenting AmygdAnalysis. AmygdAnalysis is a computer software program designed to identify amygdala phenotype via the use of AmygEFP, otherwise known as amygdala electronic fingerprint, which is an fMRI-trained EEG which quantifies amygdala activity in oscillating waves. Like an EEG, first a cathode electrode is placed upon a patient's head. Upon the patient receiving stimulus, data is collected and then run through our program, AmygdAnalysis, which then evaluates wavelength frequencies. For our work, we are focusing on beta waves because discrepancies in beta waves indicate whether a patient has hypoarousal versus hyperarousal while looking at the frequencies. In a healthy person, frequencies range from 16 to 20 Hz in beta waves, whereas someone with PTSD minus or hypoarousal beta waves range from 12.5 to 16 Hz, whereas someone with PTSD plus or hyperarousal beta waves range from 20.5 to 28 Hz.
AmygdAnalysis analyzes the AmygEPF data and determines whether an individual is hypo or hyperaroused. First, the program will load in the data and classify it. While we don't currently have access to the AmygEPF scans because the data is not publicly accessible, we are currently awaiting rights from institutions to access it. Nonetheless, the code that will be applied to the data remains the same. After classifying, we construct the actual model with 3 layers. First, we flatten the scans based on the dimensions, converting them into 1D, which is easier for the computer to work with. The scans are then fed into the dense layers, which apply certain weights to the input, trying to find meaningful features in the scan. In our case, we are looking for the beta waves associated with hyper or hypoarousal. Next, we compile the actual model with an atom optimizer, which automatically adjusts the weights in the neural network so that it can make better predictions. The loss function is used to keep track of how well the model is doing during training, focusing on the accuracy metric. Finally, we can have user AmygEPF data as our test images. We can run the model.predict function and the output as the prediction, and it will also show how sure the model is of that prediction.
AmygdAnalysis presents an efficient, non-invasive, and accessible approach to a community that deserves to be our #1 priority. With an estimated 223 million of the population suffering from PTSD, yet only 12 million diagnosed, AmygdAnalysis means a future free of the past.